Extreme Networks offers a variety of what I call hospital-grade network infrastructure. So we provide the ability for all the things that you see at this great show to connect. So whether it's medical IoT, whether it's patients, guests, whether it's to the EMR, we provide basically that critical asset being the network infrastructure to connect all the applications and connect all the things that healthcare requires to make sure that we take good care of our patients. So we have a number of different assets from a networking perspective. We have what we call our Extreme Cloud IQ, which provides best in practice cloud network services. It gives you visibility from no matter where you may be. So since the pandemic, many of our IT staff are located all over the place. They may be from home, they may be from a disparate clinic, they may be at the airport. Our cloud technology offers us the capabilities to manage that just about from anywhere, as well as our network fabric technology. So with our fabric, we have an underlying network security capability that is built into the inherent architecture of the network itself. So security is not an afterthought. It is something built into our network, and we're really proud of those capabilities from keeping our PHI and PAI information safe. From a visibility and analytics perspective, we have a number of applications and capabilities to provide our IT administrators that visibility and that capability they need to keep that network up 24/7 by 365. So why do we choose HIMSS and the healthcare industry as a part of our survey? I think we can all agree that healthcare industry at large during the pandemic was, if not the most impacted vertical within all the businesses. And I think that provided for some very interesting insight to just how well they adapted to basically picking up all the things from all the influx of folks with illness, as well as overnight shifting a large majority of our healthcare staff from working from home. Certainly not the clinical space, but the administration space. How do we manage all these different things and overnight add on all these additional remote access points? We call this the infinite enterprise, and that is the concept of people and devices operating from anywhere. They could be in a number of different locations, but that's from home. Again, lots of different places where they can operate. And we look for that for capabilities for expanding the network. So healthcare IT overnight had to support all these great things. And there was a lot of, I think, difficulty in securing and providing great access to our administration folks as they moved out of the brick and mortar hospitals. In addition, I think that in general, healthcare is evolving and requires, as a result of some of the things I just mentioned, some digital transformation. I'm not a meme guy, but there's a famous meme I think that's out there, at least famous from my perspective, that is, what drove your digital transformation? And I think the pandemic certainly was it. And certainly there's a lot of investment that's going into the information technology systems of healthcare as kind of a result. So the survey results showed us a lot of very interesting data. Some of this data is no surprise. I think some of the struggles that IT administrators and hospitals have struggled with over time. The number one, of course, was security, cybersecurity, and how do we secure our important assets, PHI, PII. How can we make sure that this data is protected? Of course, the issue with ransomware and other things. And let's face it, healthcare is one of the most sought after targets for cybersecurity breaches. There's a lot of data there outside of patient data. There's demographic data. There may be credit cards. There's a lot of different information that would be contained in that electronic medical record. Other things of concern were clinical staffing as well as IT staffing. No surprise there. Every day when I worked in operations, there was more work to do today than there were yesterday. There's another device there's another system, there's another application, there's another merger, another construction project. So IT is often not getting additional staff. And as a matter of fact, there's a lot of staffing shortages. So how do you combat that? You have to look to ways to automate things and understand kind of where you need to go to support your infrastructure with always doing more with less. In addition, the additional components are just supporting software applications, expanding the network, and a few other key components. A lot of respondents, of course, very interested in those 3 or 4 main topics. So some of the key areas for technology investment in healthcare, as we mentioned, cybersecurity. Almost 60% of the respondents said that they will be investing in cybersecurity. In general, we see that 90% of the respondents said there was going to be an increase in their IT spend, and 45% of that 90% said there would be significant investment in that spend. So as we discussed, we see cybersecurity, applications, and network infrastructure investments to drive the need for continue to bring in all these devices, all these applications, et cetera. It is so critical for organizations to have a strong network infrastructure. Of course, the demands on the IT infrastructure are 24/7 by 365. So when you look at all these different systems here at the show, whether it's medical device, all these different systems rely on the network. We really look at the network as a critical asset and really kind of formulate it as kind of that asset that is also like plumbing. If water were to go out in a facility, obviously that compromises the way to sanitize or may impact the bathrooms. Just like IT systems, if they go down, oftentimes perhaps you have to make the tough decision of closing down that facility. So we want to ensure that our networks are secure and robust and highly available. We call that clinical grade capabilities with our network infrastructure. So it's so important to think about that we have to always be providing budgets and opportunities for our strategic asset. Although that next application, that next device may be great to service patient care, it's really important to have a strategic plan for technology investment in the infrastructure to make sure that all those great devices and applications can function as the clinicians expect. I think Extreme Networks differentiates itself from some of the other competitors in the industry because we really think about what the mission is, and that's patient care. We've invested a lot of money in staff and technology to think about what the critical business flows of healthcare are and how we may align our technology to service those capabilities. So whether that's automation to facilitate those IT staff shortages, reduce human error so that device is in the right segmented network and highly secure. All those different components go into managing and processing the capabilities from the network perspective. So Extreme thinks about the workflow and the patient first, and then I think we devise our technology capabilities around those concepts of providing that not only a great experience, that panacea for the patient, whether that's access to the portals, whether it's a great guest access while you're in the hospital for patients and guests, but also for the clinicians, thinking about the total experience from a clinician perspective, because if the clinician is fumbling around with technology, that's probably going to impact patient care as well. So IT has done a lot of work in that area to focus on the clinical experience. And what we find is we've been doing things like removing alert fatigue and many other things in that space, but we really have to make sure that we provide that hospital-grade network that is highly available, and so that clinicians can fumble around with technology less and focus on the patient. Extreme Networks has done a number of things to help IT organizations improve their IT infrastructure. From our cloud-based capabilities So manage our networks from anywhere, from our analytics perspective, from managing the business and understanding what's going on the network. Additionally, the fabric technology with inherent security that's built in and not an afterthought. So Extreme Networks is very in touch with our healthcare customers. We work very closely to align with that, from what funding may be available from the government source where you may reside in the world, to many other capabilities to make sure that they have the right clinical grade networking available to them to provide the best patient care. How does Extreme Networks stay on top of the most new trends in healthcare technologies? I think it's really organizations like HIMSS. We look to the HIMSS and Gartner and other organizations to stay up on the latest trends. Of course, our vast customer network, we have over 3,000 global healthcare customers. We're very in touch with the pain points that many of us as healthcare providers experience globally. And I think we're all working forward or towards working together to solve those difficult problems that we all face. In what way does Extreme Networks work to ensure regulatory compliance? Extreme Networks has a number of different analytics and security capabilities. So from segmentation and micro-segmentation to make sure medical devices or Internet of Medical Things devices are on different segments of the network, to PCI compliance and other capabilities. We're kind of a one-stop shop to provide all those compliance and regulation needs to ensure that not only is your network configured to support those sensitive applications, but that you also can monitor and ensure that those capabilities and components are in place. How can Extreme Networks adapt to the scalability and the demands of the healthcare systems over time? I personally could attest to the capabilities Extreme Networks. I spent over a decade of my career managing an extremely large Extreme network at over 300 healthcare facilities. So over those years, I had a personal experience with supporting and ensuring that the network could scale over 9,000 access points, thousands of switches, routers, cores, all the things you need for a successful infrastructure. I utilize these personally, and one of the reasons I came to Extreme Networks is because we had so much success. I wanted to be able to take that success we had at one great healthcare provider and be able to use that experience to help providers across the globe.